once a month, we get like an average. He takes an average of our days, and then our base is 1060. So he averages then, any production over 1060, he then averages that, and we get 25% of that number.
Okay, I'm not sure I understood all that. You average your days.
It's
You average your days
complicated.
and you,
So he takes, so say like each day we work, our goal is 1060. And then you get like, so then whatever you made over that gets averaged, and then you take the average number of days and you get 25% of that.
okay.
And
Okay.
as payout for, and I actually do have a question too, unless you want to,
Good.
how often, so when you do a full set of x-rays, like say you do that once every 5 years, would you recommend charging then for a comprehensive oral exam at that visit as well? Or, because right now we're just charging for like a regular oral exam, but obviously, like, you know, at those appointments, we're trying to do full perio charting, kind of reevaluating, doing all the SWOT again. But then we're charging them still just for like a regular exam fee.
I really do recommend you repeat the comp exam every 3 to 5 years, whatever it is in your practice. I think that's a huge thing to do, and that can be a signal for that existing patient SWOT we were talking about this morning. You know, even if they have nothing on their treatment plan that's unscheduled, it's a conversation to bring back up again. You know, it's been a while. You've been coming here for 10 years. We love you. You're a great patient. Today, we're usually just telling you what you need, what's going on in your mouth. Today, I'd like to take a step back and ask you what you want, what your goals are for your dental health, and then go into the SWOT. So I don't know, Eric, do you agree with that? Going back to the comp exam?
Yeah, I agree. What's the hesitation, Lauren? Tell me what's the objection to it from the patient's perspective?
No, I think it's just, I just have a really nice doctor that I'm looking for, and he just wants to give away free stuff.
Yeah. Okay. Yeah.
Yeah.
Maybe some approval addiction?
Yeah.
Yeah, there's a fine line there between being really nice and being approval addicted. There is a fine line there. And what's fair is really then the conversation is what's fair now. And so then now you're looking at industry norms or dental norms. And the norm is every 3 to 5 years, a patient has a comprehensive exam. Now, if a patient has, like, they haven't had any dentistry done, if it's one of us, right? One of us are a patient somewhere and they never have anything, and you're doing the x-rays and pano, you're doing everything like Debbie was talking about, you're doing the peri, doing everything. Well, then maybe you know, those are the ones that you go, okay, look, you know, let's not do that. But for the most part, if dentistry is occurring and things are happening, we need to do ourselves a favor and take a step back and say, we need to look at everything, because there's things in there that we are not seeing possibly. Let's look at the whole thing. And you're doing all the stuff anyway, might as well charge for it.
Well, and that goes into legally, we have to code what we're doing.
Yes.
Are you doing a comp exam? Then that's what you should be coding. If you're not doing a comp exam, don't code that. Does that make sense?
Yes.
And remind me, you guys are out of network with Delta, correct?
Yes.
Yeah. Okay. All right.
Does that make a difference?
It might be playing a role in his thought process of, I'm going to charge someone $80 instead of $50, and their reimbursement rate is going to be much lower. You know, so the out of pocket part is probably what's playing with his mind on, you know, what am I charging for what am I doing? And so, I don't think it matters with your Denvantage patients, right? Because it's covered. Right. But for those, you're out of network insured, only Delta, all the rest would probably cover it. So it's 40 to 45% of practice that he might be thinking of in that regard. But I think it's all for one for all. Like, if you're going to do it, you need to do it for everybody. Except there is no one size fits all. Because I'm thinking if it's a super healthy patient, like, I could get it. But if on a regular basis, no, I think it should be the comp exam every 3 to 5 years.
Okay. Thank you. That answers the question.
Okay, good. Great question. Yeah.
Anybody else being paid on commission or has a different way of being paid?
How about, because that would require daily goals too, right, Paula?
Yep.
Yeah. Everybody has a daily goal. You know what your daily goal is.
That's good. Yeah, a
Okay.
lot of teams don't separate the doctor goal from the hygiene goal.
Yeah, it's
That's
got to be individual.
and that's why Eric teaches the function keys to change your view from doctor schedule where you can see the amount to hygiene schedule where you can see the amount. Yeah.
I find money all the time in the schedule where we just have inefficiencies, how we schedule, and mostly on the doctor side. On the hygiene side, it's pretty straightforward, an hour, but you can do so, you could find that money. And I don't mean to like, okay, money, but you could find that lost money by not having a whole day of like Debbie said, blue patients or prophy patients, right? You need to have a good mix. And so having an hourly goal, three large, right, rock, 3 sand, and then 2 water. That's your 8 hours a day that you can do and pretty consistently hit your goal. Now, you may be in one end of the spectrum, too many patients or not enough patients. That's going to play a role in it too. If it's not enough patients, it's going to be overdue hygiene patients, getting new patients in. There's a different game to play with that.
Which brings me to another question of which helps our production, especially if you're on commission, is do you get credit if you do whitening trays for a patient, if you take the impressions or night guard or products?
No,
No.
no, we don't get credit for that.
If,
But we also don't do
But we
it.
don't get credit for products. We like never would have time to do the whitening trays or anything like that. So we don't do.
You don't do them.
Schedule. It's with an assistant.
I got you.
And like, yeah, we just get credit for.
So for any hygienist who has opening, has availability, has the flexibility to do it, whitening is amazing add-on to an appointment or a next appointment. You have opening your schedule, get them back in, take time, do the whitening trays, review with them the electric toothbrush and the oral pick, water pick, and modular therapy if you're doing that. Whatever it is, you got to make sure that you have, if you have the time to do it, get them back in your schedule and then produce.
I have another question. So the D0180, can you only use that for someone who has periodontal disease? No, it's just if you're doing a perio eval.
Yeah.
When
Paula read that, when she read that description, it talks about you suspect, or there was a word like that said something about that code being used. And you're doing because you're evaluating their health because you believe it needs to be done, right?
Okay, yes.
Yeah.
Okay, just making sure, just clarifying.
Yeah.
Thank you.
Let me put this a little bit larger so that we can read it. All right, now let me share this for you. Here's a little bit larger so you can see that. Can you see this, guys? The description?
Yes. Yeah.
Okay.
Mm-hmm.
So here's your
Signs or symptoms. So if they have one bleeding point, or they've said something on their medical history, they're pregnant, they're a smoker, they have diabetes, any risk factor. Debbie, what are all the risk factors for gum disease? What do we have? Did I name them all? Is there more?
I was going to say they're all there.
Yeah.
Yep.
Yeah. It'd be pretty hard not to justify the need for that, I would think. I mean, it would have to be an absolutely.
I think you could put pregnant on here. If they're
Yeah,
pregnant.
I think pregnant could be there. Gosh, I mean,
Ortho.
they haven't seen you. If they haven't seen you in 6 months, I think that would qualify them too,
Ortho patient, like we talked about earlier.
Oh, yeah.
Okay. Does that help, Lauren?
Again, Lauren, I'd like to know, is there a concern or a question as to why we would bill it? Like what's on the other side of that question? I lost Lauren.
Yeah, she's unmuting.
I'm here. So we were asking because we charge a flat rate, and very rarely we don't have a doctor here, but when we don't have a doctor here, we run into an issue of that we can't charge exams for patients with insurance. And then sometimes, very rarely, but sometimes that patient will notice that and be like, well, why was it less this time? So just trying to eliminate that whole thing.
That would help. Yeah, then that would be a good solution for you. Yeah, and just make that fee the same.
It's a great idea.
Yep.
Okay, thank you.
So, and this brings up, look, things that I see missing in hygiene departments, perio at 30%. Obviously, we've been talking about that. X-rays, the 6 X-rays versus 4 bite wings, the 0180. Also fluoride. Fluoride is a big one that hygiene departments miss all the time.
Yeah.
So we have clients that are in dental intel and we can quickly run the report. Well, it has it set up as an option. I could look at the fluoride usage percentage report and I'll look at some practices that have like 9% fluoride usage rate. Now I'll ask right away, does the doctor not believe in fluoride? Is it like, holistic dentistry, that sort of thing? And I'll accept, yeah, that's why it's so low. But if it's not, that fluoride usage rate should be in the 40 percentile. So if you don't know what your fluoride usage rate is, you should look at that and say, all right, when I run my annual, probably run 2019 annual reports, you can run 6 months. 6 months will be fine, right? Paul, you can run that procedure code analysis report for 6 months and say, just my provider ID, show me how many prophies, adult, kids, perio maintenance, scaling, replanting, fluoride. You can look at all of it. Pano, like she was talking about, and you can see, you can do the math and say, well, what's my percentage of fluoride I'm doing? At an office, I asked them.
Percentage of fluoride of patients seen. That's a percentage.
Yes. Sorry. All of them. It'll include perio, new patients, everything. And it should be right around the 40% range.
And how, there's a verbal skill attached to that. You don't just say, do you want fluoride today? Debbie, how do you present fluoride, especially to an adult?
Paula, I have a lot of concerns. As you know, you've had a lot of decay in the past, and it looks like you've got areas that we're continuing to watch. We know that fluoride is a good benefit for helping to stop the progression of cavities. Would it make sense to you if we did a fluoride treatment today so that we could assist you in stopping that decay process?
Gosh, if it would stop it, I'm all about it. Go for it.
Check this out. So this is what I share with offices on that. Wow, that's really small. This is from the other Eric Vickery that's joining us.
I can see it pretty well.
Okay, for some reason. All right, how's that? Like, is that better?
That's good. That's good.
Okay. All right. So this is off of ADA site, I think. Let's see, I think it's all there. These are all the reasons that you should be recommending fluoride. This is not me writing this. I took this off of ADA site or the APA site. I'm not sure which. So these are all the risks. Okay. Lack of regular professional dental care. The 5th one down. Poor dental hygiene, the 1st one. Okay. We're in it. So now if you have a personal belief against fluoride or the chemical makeup of that, that's a totally different conversation. But I just want to show this to you. And that way you understand, look, tooth enamel defects, right? Any existing restorations or fillings, poor diet. Oh my gosh, that's 95% of America. So they pretty much covered all the bases for us to do it. Why we're not doing it is the question. So for someone like Katie Lynn, admin team members that are listening to this, you can run the report, you can look at the usage, and you can do it by provider and say, hey, our goal is 40% or more if we believe in this. Okay.
All right, good. Anybody else have a question? I had one team, they were very approval addicted. Most everyone on the team is an S. And they just had a little tiny piece of paper that they would give the patients when they came in. Would you like fluoride today, yes or no?
No. Everybody's gonna say no.
But they actually had a lot of patients check yes.
Oh, good. All right, good. That was how they got around it. Okay, at least it was working for them.
They were surprised really at how many people said yes.
I just flipped this in a practice I work with locally. The big tracker, the big practice, they were having the admin show the total cost for x-rays and would you like them or not? And so like all the patients were saying no to x-rays and they're asking me, how come nobody's doing x-rays? We don't have any x-rays. I'm like, because you're telling them how much it is and giving them an option to opt out of it instead of presenting it and the benefit of it and that your insurance covers it and all those things.
I'm not promoting the yes or no slip. I just thought it was funny that they were so afraid to do that, and it actually was.
It worked for them. It was like, you got to
The
show the
hygienist-
benefit. Yeah.
The hygienist had just gone on commission, and they were so asked the patients about fluoride, so they just did that little check off thing. The patients were okay with it.
Excellent.
Anybody else have a question? I have more questions if y'all don't. Katie, got any questions? No? Okay. How about this one? How many of you are using online patient forms now? Your patients complete all their paperwork online. Yeah, Katie Lynn, tell us about it. What are you using? What system?
We use the intake queue, and I think it appeals to a lot of patients because when I say that all you have to do is get online for about 5 minutes and then click send, it just comes right back to us. You don't have to print anything out. You don't have to wait and do it in the office. We just have it immediately, and we can put your information in before you even come in. It appeals to them because it saves them time, and essentially it saves us time too.
Yeah, it's really the bomb, doing the online form. I have a large group practice that just started with Dental Symphony. Has anyone heard of that? Dental Symphony, and they're loving it so far. They've got like 7 or 8 offices. And
Don't point it at me.
so you may want to check that out. There are some. Let's see now. This group practice, they have the Dentrix Enterprise, so it's working with that.
Yeah, Medento is another one.
Medento. Now I had somebody with
Yep.
Dentrix saying
Yep.
Medento was not working well for them. I don't know if it's
Yep.
them. Or,
And then Yappy is another one. YAPI. Yep.
Mhm. Yeah.
There's another one. I can't think of the name right now that I just like to show clients, hey, go look at these 3 or 4 and,
Yeah.
and pick out what you want. It's getting a lot of overlap though if you use Weave, and because they'll want to
Yeah.
do text messaging to get the paperless forms in them. So hopefully Weave will come up with
Yeah.
some adaptation and
I heard they were.
include it all. Yeah, that would be great.
So what are, that was my next question actually, Eric. What patient communication system are you using? I know some of you are using Weave. Who's using Weave? Okay, that's great. Debbie, what do y'all use?
We use Revenue Well.
Revenue
Is
Well.
that- Yeah.
That's because you have
And-
EagleSoft. That works well with
Mhm.
EagleSoft. It's an EagleSoft product. Yeah.
Yeah, it is. Dr. Netzley, what are you guys, you using
They
Weave?
use Weave. Yep.
Okay. All right.
And what's Dr. Kent? What up in Alaska? What are you guys using up there, Caitlin? Solution Reach or Lighthouse?
Yeah, we use Solution Reach.
Solution Reach. Yeah. Okay.
Okay.
Yeah. Here I'm gonna throw you guys a curveball. Okay. You ever see the text message that says if you'd like to opt out, just say stop, right? And you can opt out of your text messaging software. So for all of you hygienists who have overdue hygiene patients that you're thinking are getting a text message every 30 days saying, hey, you're overdue, we're concerned about you, would you like to schedule? Just so you know, they could have opted out of that. Okay. Now, the fix is every 2, 3, 4 years, switch, go from Revenue Well to Solution Reach to Weave and rotate through. Because when you rotate through, they're all opted back in. Everybody's back in the text message system. They're all about the same cost. They all do really great things. Weave is my favorite. Solution Reach is number 2 for me. Then I have a couple close for third, Revenue Well and Legwork. And again, they all do about the same thing. And it's just what you get used to. And again, it's not going to cost you a fortune, especially if you do it around December 31st. They're wanting that last sale of the year, and you can get a lot of things waived. or say that Paul and I referred you, and then you get those fees waived too.
Okay. All right. So there's a lot more we have left to cover tomorrow, as you can see. Excuse me.
Bless you.
That
Bless
was
you.
free. Where'd that come from? And so why don't we do an overview, Eric, of what's coming tomorrow?
All right.
You have your
Yeah. So we're going to start out with case presentation and closing. We're going to reintroduce the tracker I showed you on case presentation tracking. If you want to look at that, I think that's an amazing document that coincides well with everybody leaves an appointment being created. So we'll start there. We'll do a little breakout on that, and everybody will practice. We'll work on it. Make sure that we all discuss case acceptance and the trackers and closing. Then we'll get into insurance, objections, those types of things. Transfers, we'll work on transfer of trust, transfer of care, transfer of power. And we'll be close to the end of the day. We'll work on overdue hygiene. And then we'll have a big breakout towards the end of the day on masterminding all of the topics we've been working on and creating an action plan. Everybody's going to share their ideas on what they're going to do when they go back. And then we'll wrap it up.
I want to do some of the aha moments from today too.
Yeah.
And if you have questions, feel free to message us, email us. You have the email from Eric. You can certainly send us a question for the group that you want to cover, or something you want to talk about tomorrow. But I'd love to just go around the group and talk about aha moments. What are some things where the light bulb came on, or you got a great idea from today? It might be one or two or more things. And why don't we start with Katie? Katie? Eric, you have to help me keep track of who we've asked so I don't miss anybody. Katie, did you get some ideas today?
Yes, I really like the last one that we just talked about with the fluoride.
Oh, yeah.
It was helpful to hear from Debbie how she's been doing it and incorporating it into her adult patients. We do see a lot of holistic patients, but I kind of have it narrowed down of who I know that is holistic and not, so I can offer it to them for sure. And then just talking about the 10 like we were earlier, I really like that. But yeah, everything was really good. You answered a lot of questions, so.
Good. All right. Thank you. Thank you. All right. What about Katie Lynn?
I also like the fluoride thing. As front desk, I could be the first face if I notice that it's not on the appointment, or if their insurance doesn't cover it. I can always say, is this something that you're interested in during your visit? And then I really want to start tracking everything. We don't use Eric's tracking tools, and I think that would be super helpful and beneficial. Like, I have no idea what our perio percentage is, but I know that we're not diagnosing enough perio therapy, or as most people call it, scaling and root planing. And then you said something earlier about, let me see if I can find it. Well, even celebrating negatives are not negative necessarily, but I like that we can always talk about it and see what we can make positive from it. And you said something, that
Celebrate the negative. Like, what can we do about that? Eric was talking about.
You said something about perceiving, and I can't find it. Personal growth always precedes professional growth. Is that what I really like that. And I feel like I'm going to hold on to that. Even though it's not
For me, it was me in my personal life. And I see in dentistry, you think about it. You get a doctor who's trained on the level of Dr. Netzley and Dr. Allgood, and they're really good at what they do. They're advanced in the dentistry techniques, and then you have maybe a team member who's right out of high school, and they haven't really lived a whole lot like people our age have, and so there's a gap in personal growth and maturity, and I think we expect them to be at the level where we are many times. And so helping a team member grow personally, Maxwell has a great book, The 5 Levels of Leadership. The first level is positional leadership. The second one, you know that book? The second level is the permission level of getting team members to follow you because they like you. Third is production. Fourth level is personal development, helping your team grow personally. They follow you because of what you've done for them. And I'm a certified Maxwell coach, and I love his leadership materials. So, that was true for me. My doctor was very good at developing us personally as a team. I mean, he didn't try to get into our personal business or anything, but he was always offering us personal growth opportunities. I'm glad that resonated with you. Thank you for saying that. Okay. Who do you want to go next? Let's see. Melissa, your name's kind of popping up for me next.
Hi.
Oh, whoa.
It's your computer. Just use your...
We're hearing through 2 microphones, so we got to turn 1 microphone off.
Yeah,
probably. Yeah.
It's all right. Okay, Melissa. And that's muted. What you're talking into is muted.
Unmute that one you're on. There
Now,
you go.
there we go.
I'm here. Sorry.
That's all right.
I I really enjoyed going over our visions. So personal and professional, that's something that I really need to work on myself as a professional and personally. And I think I would like to go over more of like our group vision as well, since I'm not like super new, but relatively new. And so that's something that I've learned a little bit about, but not, I guess, have the full scope of it. My periodontal percentage, I would like to know my personal percentage as well as a group and what I should be reaching towards. And I would say too, like just learning about, or even just going over what our protocol should be for like x-rays. We've had a lot of good discussions today about different ways that we can, do x-rays. And so that's something that I'm excited to kind of go over, and I'm glad that we went over today. So,
That's good. Awesome. Thank you. It's been fun having you. Appreciate your participation.
Yeah.
So while you're there, turn over to the next person, Julie.
Okay. There's Jen.
Okay, Jen. Hi, Jen.
For me today, I got a lot out of maybe revamping and looking at. I'm seeing a lot of pan and bite wings coming out of initial patients, and we're then converting them into scaling root planing type of appointments. And we were talking as a group, and I'd really like to see maybe the doctors really start with going back to the old ways of doing things and doing the complete series, individual pictures along with the pan if they want it.
Okay.
I liked the idea of using the code for patients when they come in, and it should be a no doctor day. Running 2 practices with 3 doctors right now, soon to be 4 in September. Sometimes that can limit what we can provide that day. But with the perio charting and all of that, we're able to give them additional services with the value to their appointment.
So you're talking about the 0180?
Yes.
Okay. Very good. Yeah, it's much overlooked in dentistry.
Yes. Okay.
Awesome. Thank you. Okay, who's next in your group?
Hey, Lauren.
Here. For me, I've obviously done a lot of this, but it's always good to get a good review. And I feel like I always learn something new every single time. And I think, like Missy said, working on our own vision, we have an office vision, but I think just coming together to make all of us on the same page is good, because we are clinically, but I think also philosophy would be a good thing to do. Mm-hmm. And then just learning lots of things that I can do to improve my care for my patients. So thank you guys, and I appreciate you guys for putting this on.
We appreciate you too, especially
and Kayla.
You've heard it before, and you can find value in listening again. Thank you. That was really nice of you to share.
Thank you.
All right, Kayla?
Yeah, because I've heard a lot of it before too, but it gives me more motivation. Like it kind of renews it a little bit. And I like the idea of with the FMX visits doing more of a comprehensive exam at each one. And I like when you were just talking about negativity and being the thermostat, not the thermometer.
Yeah, that's great. Yeah, be a tone setter. That's very good.
Yeah.
Thank you.
You're welcome. That's all of us.
Oh,
Great. Did you
Julie.
go? Oh no,
No, I didn't.
Julie still need you. For some reason, I thought she started.
Hello. I like Debbie's idea of swatting the previous month or previous 2 weeks even for the
Yeah.
hygiene team. We're 2 different offices now, and I was at Mount Pleasant for 15 years, and now I'm at the new office, and I think our stresses are very different, but we both offices have lots of stress, especially because of COVID and whatever they are. They're very different, but I'd like to just talk about how we get through our days and help each other and support
That's
each
good.
other.
That's really good. For those of you who don't know, their second office was supposed to open in April of last year, right smack dab in the middle of COVID. Brand new second office, just built, brand new building. And that had to be, it was just so stressful for you guys. It's just been such a journey. So we feel your pain, but yeah, that's really good, Julie. Thank you for sharing that. Okay, Dr. Netzley? Would you like to share?
Well, I'm a perpetual student. I'm forever being going to your courses. I think the biggest thing is going to be the PR and the verbal skills. It's going to be an ongoing process for me.
Yeah, it is. It is for everyone. Practicing and, you can always, get you some hats, Dr. Netzley. Yeah, I know. That's good. We really appreciate you, Dr. Netzley. We've known you for a long, long time, and you're just amazing and inspirational. If you don't know this guy, he's building his own house. He's a musician.
Photographer.
He's a photographer. I mean, he's just something else. Into lots of stuff. Did we miss anybody, Eric?
Debbie and Dr. Allgood.
Yeah. Would y'all like to chime in? Dr. Allgood, thank you so much for joining us today.
Yeah, well, it's been my pleasure.
You changed clothes.
He's going hunting.
Yeah, I did change. I won't be here tomorrow, but thank you for letting me be here today. I think I'm always having aha moments, but thank you for stimulating my brain a little bit. When you're not doing the dentistry every day, you got to have something to work on. But thank you for that.
Well, you're a great mentor, so we love having you.
Well, I love doing it. And then one thing that I always get out of this is that I need to continue working on my verbal skills for personal stuff, like love languages. That makes a big difference for our spouses, for our kids, and for those that we relate with. And also the fact that I need to continue working on my vision.
Yeah, for sure.
There's not an end point that you should be striving for in your life. That's why I've got up here the poem, The Station. Yeah. So,
yeah, that's good.
Excuse me, I get emotional about some of this, but yeah, I'm still on the train ride and I'm not looking for the station yet. And
good. That's right. The dash, you're born and then there's a dash and then the year you die, how are we living the dash? They call it. Yeah. That's right. That's very good. Debbie?
I enjoy doing this and meeting everybody, and it kind of makes me realize how much more that I even have to work on things. It doesn't come easy. You have to keep practicing. And I would love to see our hygiene department write the vision. I'm not sure that we've ever actually sat down and done that. The practice has a vision, but as a department, I know our hygiene department does not.
Right. That's good. And we have a team, Eric and I have a client who does a vision board as a team, and they put things up there that they're looking forward to, like equipment or, different things. And they love the vision board idea too. So that can be fun, putting one of those together in pictures. And appreciation boards, I've had people make those with, according to the love language, they'll make an appreciation board for each person on the team and put the love language up there and different things they like. And so lots of creative things people really get into. So we love that. All right. Well, we're, anything else we need to cover today?
I learned that I don't have to have lunch every day. That's what I learned.
Did you not get any lunch here?
I could use not having lunch all the time. I think that's what I learned today. So
Just make sure you feed your fish.
I did. I did block you guys out and went and fed them because they were acting like piranhas. So
I did have a shake.
Yeah. All right.
So that's the thing about leading the Zoom meetings. We're not all taking a big lunch break, and you have to
Power through it. That's right. Now, it's so good to have Paula and teaming up with her. It's been great. And look, so much more tomorrow, guys. We got so much more to cover. Very excited to talk to you about case acceptance and case presentation, tracking hygiene, and how you can change your practice on the doctor side through the hygiene department. So,
yeah.
And we're going to be talking to Debbie about that a lot too. So,
yeah,
all right. Awesome.
Looking forward to it. All right, you guys have a great evening or afternoon or whatever, wherever you are. And,
late lunch.
Go get something to eat. And thank you again for your attention and your time. And I hope you got some good action items. I took 5 pages of notes.
Wow.
So thanks a lot. We'll see you tomorrow.
See you tomorrow.